Take a Piece of My Heart. During the 2005 Grammy Awards, Melissa Etheridge sung a song to acknowledge to the world that she was fighting breast cancer. Expressing her feelings and the feelings of so many others, Take a Piece of My Heart has become a symbol of fighting against breast cancer. Think it won't affect you? Think again. 1 in 8 women will get invasive breast cancer in their life. Rich, poor, it doesn't matter. Melissa Etheridge, Sheryl Crow, Suzanne Somers, Olivia Newton-John are some of the entertainment's most talked about and wealthy stars, yet they all have fought the fight. Defined by American Cancer Society as a form of cancer that starts in the cells of the breast. Breast cancer grows and invades the cells of the breast and may spread to other organs in the body. In the United States, the American Cancer Society estimated that 2,829,041 women are currently fighting breast cancer. Another 230,480 new cases will be diagnosed this year. Breast cancer will claim 39,620 of these lives. According to the National Cancer Institute, $13.9 million will be spent to 2013 fighting this disease. While breast cancer is generally found in women, it may also be found in men. Some who suffer from breast cancer will be asymptomatic. Others we'll see in the poster board may include lump or thickness in their breast. Breast cancer signs and symptoms: lump or thickness in your breast, discharge from your nipple, color changes in your breast, changes in skin around the breast, and an inverted nipple. Diagnosis of breast cancer can be made by trained healthcare providers. Once suspected of having breast cancer, you will undergo a diagnostic mammogram or x-ray of their breast. Your doctor may also order a sonogram of your breast and may use this ultrasound to insert a fine needle into the breast tissue to biopsy or get a sample of the tissue to look under the microscope. To determine if you have breast cancer, when you are diagnosed with breast cancer, you have several treatment options. You may choose either a lumpectomy, where a surgeon surgically removes the lump of affected cells in your breast, or a mastectomy, where a surgeon removes the entire breast. After a decision is made regarding surgical intervention, you will have a choice of undergoing treatment with radiation and/or chemotherapy. Radiation uses powerful X-ray beams to kill the cancer cells, and chemotherapy uses powerful drugs to kill any remaining cells. Which treatments one may choose are personal choices and may be affected by the type of breast cancer you have, or whether or not breast cancer has spread. Healthcare provider recommendations and personal choice. Because current treatment options are proving to be quite successful, the 5-year survival rate is 89.2%. Furthermore, there are many known risk factors for breast cancer. As you see, having a family history, early onset of menses, late onset of menopause, late childbearing or no child, smoking, alcohol or obesity, and environmental toxins increase your risk. Currently, genetic studies for BRCA1 and BRCA2 genes are being used to help family members determine if they have a gene. Angelina Jolie, if you'll recall, recently underwent a double mastectomy after learning she had the gene. A fair likelihood of developing breast cancer. Other known risk factors include early onset of menses, late onset of menopause, not having children, or having children late in life. Using either birth control pills or Depo-Provera also increases your risk. Hormonal therapy after menopause also increases your chances. We also know that smoking and drinking alcohol increases your likelihood of getting this disease. Environmental exposure to radiation and other toxins also increase your risk. Knowing these risk factors and the things that you can do to reduce your alcohol risk include exercising regularly and limiting your use of alcohol. Avoiding hormonal forms of birth control is also known to decrease your risk. Because both men and women can get breast cancer, you should perform monthly self-breast exams. I am passing around this pamphlet, which you have received, explaining the process of monthly self-breast exams, but it's also important to remember not only to do a breast exam each and every month, but to do them on the same time each month. For ladies, preferably 1 week after the first day of their last period. This will keep you from being confused by normal hormonal changes in your breast. Any changes in your breast tissue should be reported to your healthcare provider. Women should have a baseline mammogram between the ages of 35 and 40, and all women 45 years and older should have annual mammography and yearly breast exam for their healthcare provider. So, men love your women and women love your men. Exercise regularly, don't smoke, drink excessive alcohol, encourage monthly self-breast exams. Have an annual mammogram as indicated. Don't become one of the 2,829,041. Reduce your risk. Don't let breast cancer take a piece of your heart. And on your self-breast exam pamphlet, it tells you, while lying down, use the 3 middle fingers and apply 3 levels of pressure in circular motion. Follow up and down pattern. Check for ranges with hands on hips and chest muscles flexed. Examine underarm while upright and arm slightly raised. Monthly breast self-exams should always include visual inspection with or without a mirror to note any changes in texture, a manual inspection in standing and reclining positions to note any unusual lumps or thickness. Scan again.